Pasta.
And
Flip.
flip the card. Oh my God, Gio, you're awesome. There are some questions I actually, either way, so which you ask me if I can ask you the questions. But it's all written in Korean, so I have to translate. But some of the questions I don't even understand. That you are actually Korean American, head doctor in BTC, the headquarters, the Newports.
Yes, exactly. Yeah, I started, I've been in practice about 23 years.
Wow, and then you look so young.
Oh, thank you. You're so nice. And then I was the first doctor to really use MERT in Newport Beach. And
okay.
And so, yeah, it's been a long time. It's been a long time, but you know, it was nothing that was trained in school. So about 10 years ago, I started working with the head company, and my husband was a consultant, medical consultant for them. He's neurosurgery, and my background is internal medicine. And they asked me, would you see some patients for us? So I started back when it first began, and then since then it's just grown and grown. And then we were the only clinics in California, and then in 2018, 2019, Wave decided they wanted to not open clinics. They only work with my clinics, but they wanted to send the technology all across, you know, everywhere else. So at that time, they asked me to train all the doctors. So anyone who wants to start using MERT, they go through, I do a probably 40-hour training session every month. And so I meet all the new doctors and I train them. And so that's kind of my job, answering questions.
Right. But thank you very much. Actually, now that I connected the right person to ask a lot of MERT questions, I'm so glad and honored. Thank you so much.
It was very fast introduction. Someone sent me a link, and my Korean is not very good, but I can understand a little bit. And I thought, wow, they have a lot of questions.
Are you really working doctor in a MERT therapy, or you are just a training doctor?
No,
doctor.
I've been seeing patients for 10 years. And then, so now I do both. I see patients, which I actually have probably, right now there's a good number of Korean patients coming through Newport Beach. And so I also work with other doctors. Dr. Lee was with me for 9 years. She's a pediatrician. She actually just kind of retired from BTC. And then I have another clinician, Kaylee, who's also working with me. But I really tried in the last 6 months, because we've had such an influx of Koreans, to be the doctor for the Korean patients, because I think it helps sometimes when they can't say something that I can understand. And so yes, so I am practicing. And
so you're practicing doctor.
Yeah, 3 clinics.
That's nice. I don't know how much you understood about my videos, but basically I have no knowledge about MERT professionally. I'm just one of autism mommy. So I really don't understand some medical questions. So it's basically some questions from Daddy. It's a very medical professional question. So I try to translate into English and let's see.
Okay.
Yeah.
He had treatment. His son had treatment.
Yeah, he had a treatment. I think he went through 8-week treatments. He was told after first MERT, there is a kind of a booster. It's not booster, second MERT.
Okay, I'll explain. So normally we start with 2 weeks. We do a 2-week assessment because we don't know which people, and not just children, we see adults too.
Okay.
We see traumatic brain injury, PTSD, depression. So we see a big range of patients, but we always start with a 2-week assessment. And basically that 2 weeks is to determine, we do baseline EEG, we do 9 treatments, and then we do a follow-up EEG, and we see the patients again, and we decide at that time, are there any changes, clinical, are the parents noticing changes, and 2, are there EEG changes?
Oh, yeah.
And if those are happening, then we know the treatment is worth doing, continuing.
Okay.
If we don't see changes, then we have to decide, is it just taking too long? Or is it going to happen next week? Sometimes it takes a little bit longer than 2 weeks. So we sit down, we kind of decide, should we continue or should we stop? And that's, a decision. It's a decision that we make together. And if we decide to continue, and if things are good happening, there are good changes, then we'll usually do a total of 6 to 8 weeks of treatment.
Okay.
And the reason why is because now we're seeing good changes. We want it to stick. We want it to make sure that we remind the brain every day, this is how you want to fire, and we start the neurons to kind of start developing. And so we recommend 6 to 8 weeks of treatment.
Okay.
Right around 6 to 8 weeks of treatment, normally we see kind of, patients getting better, and then we see plateau. The progress is kind of staying the same. We don't see a lot of improvement after that, about 6 to 8 weeks. So we, at that time we say, okay, this is normal. Most people, the brain can only change so much. We can push, but at 6 to 8 weeks, then it starts to stabilize.
Okay.
So then we recommend for parents who want to come, they saw improvement and they want to come back because now they see like good things happening. They want to see next time, can we do more? Can we get more? Then we usually recommend maybe 6 months or a year later, come back. And now we plateaued and we see more improvement.
Oh, okay.
And then usually it's not 6 to 8 weeks because the brain remembers pretty quickly.
Oh, okay.
And so the second time, usually it's only maybe 4 to 6 weeks because the brain is quicker to respond the second time.
Oh. So second time is a quicker.
It usually is because the brain remembers and it just picks it right up. And so usually we only have to do about 4 to 6 weeks of treatment. But there are some people who at 6 weeks or 8 weeks, they continue to see improvement. Their child is continuing to improve and the EEG is continuing to show change. Sometimes we recommend, hey, let's keep going. Why stop now? We haven't hit the plateau. We haven't stabilized. And so sometimes we will have patients who stay 10 weeks, 12 weeks, but to set, from the beginning, it's usually 6 to 8 weeks. I mean, that's pretty average. So we don't want to say, stay 12 weeks when it's really, most people start to stabilize at about 15.
Jimmy, you are talking about this first MERT treatment. It's normally 6 to 8 weeks, most of cases, but if the child continued to progress, then you recommend even go further. Okay, I got it.
Yeah.
Is there any, like you said that maybe after some time the brain stabilizes the progress, and then you recommend the patient to come back after 6 months, between 6 months and 1 year, and to get a second merge treatment if the parents want to have further progress. That's right? Is that based on your data, like the children who got the MERD treatment? Is that some data? I'm sure you have a lot of data. Is that based on a data, or is the brain works that way?
It's mostly based on just experience.
It's just experience. Okay, I got it. It's a long time. I'm sure you have so many patients and so many experiences.
Yes, but with MERD, it's only been around for 10 years. And so the first, I've been practicing for 23 years. But MERD, I was the first provider, but it's only been 10 years. And 10 years, I guess it seems like a long time, but it's not. I mean, 10 years is pretty short.
Okay. So the MERD is basically one of the TMS treatment. It's actually a treatment with the TMS. That's the machine name. And MERD is your unique protocol to give TMS treatments for development delayed children. Is that true, right?
That's right. That's right. So TMS has been around for 30 years. It's been around a long time. But the last, in 10 years ago, we combined it with EEG guidance to create protocols for each individual patient. And because when that happened, we could treat off-label. Because usually before 2000, before MERD started, the TMS was only used for depression.
That's true.
There was no other use for it. But now when MERD started, we were using it off-label for PTSD, traumatic brain injury, autism, depression, anxiety. So we've expanded the use of TMS because we've personalized and I've talked to doctors who were previous TMS users, and they've only used it for depression. They added MERD maybe 1 year ago, and they say that MERD is definitely works better. People who have failed TMS, when they do MERD, they get better.
Is it I'm sorry. So basically TMS, but you read the EEG, and just the individuals have different EEGs. So you connect the EEG with TMS. That's MERD. And also it's a different name. Is RTMS. Is there any difference? Or they are RTMS, or they are also using QnA-J, right? Or it's different? Okay.
RTMS is TMS.
Okay. Yeah. So they don't really use the EEG. Even in Korea, we have some TMS centers. And because of this MERD, we don't have a MERD in Korea, even though I live in Dubai. But there is no MERD center in Korea. And now a lot of people get to know about this MERD. So instead of, it's really far away from Korea to States or Australia. So they choose to go to TMS center in Korea to get a TMS treatment, believing that it might do something on autistic kids. And there are some doctors who actually use TMS to treat the autistic kids. What do you think about that?
That is a little worrisome because standard TMS is one protocol. Everyone gets the same treatment. Everyone gets, and what I mean by that is when we create protocol, we're creating the speed at the fire, the speed, the frequency. We're creating the intensity, where like how strong we treat, and the protocol also consists of location, what location in the brain we should treat. With traditional TMS, it was meant for depression, and they treat the left dorsal dorsal prefrontal cortex, like a location on the left side, at standard, 10.2 hertz. Everyone gets 10.2 hertz, or the speed.
Yes.
10.2, same location. And if you look at most brains, it's not 10.2. You see 9.8, you see 11.1. And so there is some harm, there is worry that there could be harm if you're treating children with the protocol that was guided for depression in adults.
So basically, it's not a protocol for autism. It's protocol for traditional depressions. Actually, TMS is designed for. Okay, that's the purpose.
Yes.
So you think it's a possible harm?
And I don't. Potential.
Potential harm. Yeah.
And I don't know what the doctors are doing. Are they changing? I mean, maybe they're choosing a different location. Maybe they're choosing a different speed or frequency. But how would they know if they didn't do the EEG and all the data to create that protocol? Yes. I've heard some stories, bad stories, so I don't want to generalize to say, it's bad, but I've heard some, worrisome stories of patients kind of going to the wrong centers and getting the wrong treatment, or treatment that, wasn't designed for that patient.
Because I'm sure that parents, including me, really want to get a MERT because it's we all know is designed for autism. However, it's because geographically, it's especially autistic kids struggle to travel. They're not really used to it's a strange environment, and they have a behavior some challenges. That's why parents don't really have choice but want to do something about it because they were told it's really working many cases. Do you have any plan to open Korean branch? I know there are some kind of the trials or efforts by some Korean parents and doctors.
So I looked into it because I was interested in could I open a clinic in Korea?
안녕하십니까, 지오맘입니다. 이번 영상은 저에게 참 특별합니다. 저번 주에 BTC 뉴폴트 지점의 그 의사 한 분이 저와 컨택을 원하셨어요. 제가 그 당시에는 이분이 어떤 분인지 사실 말만 들었지 제대로 몰랐어요. 그런데 이제 이분이 그 멀트 치료를 아이들에게 최초로 적용시킨 의사분 중 한 분이시더라고요. 물론 그 웨이브 뉴로라는 회사에서 여러 의사들과 함께 그 멀트 개발을 함께 하셨고, 그래서 이분이 Q&A 영상을 저에게 제안을 해주셨어요. 굉장히 특별한 기회였습니다. 다만 제가 이 영상을 만들면서 조금 아쉬웠던 부분은 이분이 저번 주 목요일에 저에게 연락을 해주셨는데 그 줌 통화 날짜를 토요일로 잡으셨어요. 제가 직장맘이기도 하고 또 이 모든 인터뷰를 영어로 진행을 해야 하기 때문에 사실 저는 통번역 쪽 일을 전혀 하고 있지 않은 사람이기 때문에 저에게는 무리가 가는 그런 영상이었습니다. 하지만 이 기회를 놓칠 수가 없었어요. 아마 이 지구상에서 멀티에 대해서 가장 정확한 Q&A를 할 수 있는 분이 이분이실 거라고 저는 생각합니다. 그래서 제가 시간이 너무 없는 관계로 여러분들에게 어떤 질문을 받아올 시간이 없었어요. 그래서 제가 아는 지인 몇 분에게 질문을 받는다고 제가 메시지를 보냈고 그 질문들을 간추려서 정말 급하게 이 줌 영상 인터뷰를 만들었습니다. 제가 원어민이 아니고 또 통번역 쪽 일을 전혀 하지 않는 사람이기 때문에 이런 동시통역의 전문 분야를 제가 이 의학 용어와 함께 적용하려니 저는 너무 힘들었습니다. 그래서 이 영상을 보시면서 프로페셔널하지 못한 점, 이런 부분은 그냥 감안하고 봐주시길 부탁드립니다. 그러나 저로서는 최선을 다한 겁니다. 이번 영상만큼은 이 멀트의 1인자가 나와서 하는 그 Q&A의 형식이기 때문에 무게가 엄청날 거라고 생각을 합니다. 그만큼 도움도 많이 될 거라고 저는 믿어요. 이 줄리킴 의사 선생님께서 앞으로도 질문이 있다면 언제든지 연락을 해달라고 너무 영광스럽게 저에게 제의를 해주셨기 때문에 이런 Q&A 영상이 앞으로 또 얼마나 더 있을지는 저도 모르겠습니다. 다음에 한다면 아마 지금보다는 훨씬 나을 거라고 생각해요. 이 영상을 편집을 하려고 했더니 편집할 부분이 없는 거예요. 제가 정말 제대로 질문을 못했는데 너무 찰떡같이 대답을 잘해 주셔가지고 편집할 부분이 없었습니다. 그래서 이 영상이 많이 길어지더라고요. 1시간 한 20분 정도 줌통화를 했는데 아무리 줄여도 이게 거의 40분 정도의 영상이 나오더라고요. 이 인터뷰만. 그래서 제가 본의 아니게 이 영상을 반으로 잘랐습니다. 한 번도 제가 1, 2부로 제작한 적이 없는데 이번만큼은 1부와 2부로 나눠져서 영상이 올라갈 예정입니다. 이유는 영어로 진행이 됐기 때문에 제가 번역을 또 해야 하는 이런 시간적인 문제가 많아서 오래 기다리실까봐 제가 반으로 나눠서 번역을 했습니다. 이 부분 양해 부탁드립니다.
Who wins?
This week.
Why is you? Paw Patrol?